We have Medicare D for prescriptions. Is there supplemental insurance for Plan D?
No, there's not. Yeah, Medicare D, you kind of live with it. Now, there are some patient assistance programs sponsored by pharmaceutical companies. That's called a patient assistance program, and Select Care Benefits Network at scbn.org is the best at helping people walk through that. There's also some free information that's not as, they don't advocate and walk you through it, but at places like needymeds.com that talk about patient assistance programs. And years ago, I mean, patient assistance programs are basically programs that if you can, sponsored by the pharmaceutical companies, if you can show that you don't have the money to pay for your prescriptions, you're under a certain income level that their bureaucrats decide, and you can show that you don't have the insurance or another means of having this medication paid for, and you jump through and fill out that much paperwork and everything's perfect with the right proof of income, the right documentation to prove that you're right, they'll send you a 90-day supply of your medicine for free. Well, before that 90 days is up, you're going to have to do it again in most cases, and it becomes a cumbersome process, but you can get it. Again, so needymeds.com has a lot of information on that, and Select Care Benefits Network, another company I do have an interest in, is something my father and I started years ago. They walk people directly through all of those programs, full-on case management. And those programs are now starting to open up with people on Part D. So when you go into your donut hole, that $3,000, around $3,000 gap where you have no coverage at all, and sometimes a few programs will just let anyone with a low income on Part D get their medicine. So you can look at those things. But is there a supplement that fits into that gap in Part D? No, there's not. But the patient assistance programs also are now starting to work with Part D patients where they once didn't. So they don't consider it. They don't consider that you are eligible for Part D or that you have Part D to necessarily exclude you from being able to get that. They'll look at whether or not you actually have the means or if they're actually paying. So again, very complex issue. scbn.org, prescriptionassistance360.com. Those are a couple websites. I encourage people to go look at those things.